Hello, and welcome to this faculty development snapshot on the flipped classroom. My name is Shanu Gupta. I am an academic hospitalist at USF. The objectives for this presentation are to discuss with you the value and challenges of flipped classrooms, and to discover opportunities to flip your teaching and learning experiences in pre-clerkship and in the clinical learning environment. In the traditional teaching model, students attend a lecture where a transfer of knowledge occurs. This is followed by self-study, where the student integrates the knowledge learned. The flipped classroom model, on the other hand, focuses on the transfer of knowledge to happen pre-class, through videos, podcasts, and other learning activities. This is followed by knowledge integration in class using the content from pre-class work through group facilitation. The purpose of the educator switches from sage on the stage to guide on the side. Research has shown that flipped classrooms have a positive impact in several domains. Self-regulated learning is enhanced through improved concentration, engagement, motivation, confidence, satisfaction, self-efficacy. Tasks in class offer lots of opportunities for learning with use of higher cognitive skills. There is noted enhancement of problem-solving ability, critical thinking, and decision-making, and an emphasis on competence orientation. The success of flipped classrooms lies in its student-centeredness. For example, pre-class materials can be accessed by students anytime, anywhere, giving them more autonomy in their learning. Students also have increased opportunities to engage with their peers and their teachers, allowing direct and more timely feedback both for the student and for the educator to clear up misconceptions quickly and to adjust the next set of learnings to address gaps noted in this lesson. Let's consider some real-life examples, both of which I have experience with personally at other institutions. In the pre-clerkship setting, students were being taught physical examination skills in small groups from a range of clinical faculty. During their promotional OSCEs, we noted heterogeneity in exam performance and dissatisfaction from clerkship faculty on student physical examination skills. We pivoted to a flipped classroom model. Written and video materials were developed that students reviewed before practicing with standardized patients in a simulation lab. The SPs gave direct feedback on exam maneuvers to the students during the encounter. As part of the final course assessment, students demonstrated mastery by completing a checklist of exam maneuvers on SPs in the simulation lab. This resulted in a more standardized approach for all students to achieve mastery, averting different techniques used by different faculty, as is traditionally the case. A second example, this time in residency. In preparation for outpatient clinic didactics, residents were asked to review a specialty guideline. Using a team-based learning approach, the residents were quizzed on the guidelines at the beginning of class with responses reviewed immediately. They then worked in small group through several cases that utilized and challenged the guidelines. Once the cases were completed, facilitated by the faculty educator, the small groups took turns in teaching the others learning points from their individual cases. A final post-test with immediate feedback provided all learners the expectation of the desired knowledge outcome. As all instructional activities, the flipped classroom design faces some challenges. The amount of preparation time for the educator is significantly higher for both pre-class content and in-class activities. Utilizing purely reading material is insufficient for pre-class activities and must be supplemented with additional content, such as video or podcast. Although evidence suggests student satisfaction with this model, the amount of pre-work is cited as a major barrier to student engagement. Studies suggest instructors should limit total length of all combined video content to about 20 minutes and individual videos to no more than 6 minutes each. To conclude, a flipped classroom model can improve transfer of knowledge and create a learning community. Preparation is key, and with careful design, in-class activities can promote higher order learning. What is your commitment to your learners today? What are some opportunities for you to flip your teaching practice? Thank you, and here are some references provided to help you build your next flipped classroom. I look forward to hearing from you and what you have created.